Hi there, it's Luke from Genuine Physio, and in this video I'm going to take you through 5 exercises that you can try at home if you have golfer's elbow, and we're starting right now. So I'm going to start off with a couple of isometric exercises, and isometric exercises are best for people that have quite irritable symptoms or want to start off nice and gradually. They are the most basic type of strength exercise that we can give you, and therefore they are likely to irritate your symptoms least. So the movement that is irritated, or the movement that is responsible for your symptoms, is this wrist flexion. So it's this movement that we need to try and get stronger. And the theory is we need to drop things down to a level that your symptoms are happy with, and then condition these muscles to the things that you want them to do. So we're going to push up whilst pushing down with the other hand. And we're going to do it with a bent elbow. So I would start off with your elbow at 90 degrees. You're going to push down and you're going to hold. Now I would start off with a 5-second hold, aim for 10 of those. And if you find that okay, then the way that you would progress is just increasing the length of time that you're holding for. You can work all the way up to 30 seconds. I'll probably go from 5 to 10, 15, and then 20 or 30. Once you're quite comfortable with that exercise, exercise number 2 is going to be very similar, but you're going to complete it with a straight elbow. So you're going to straighten your elbow and you're going to do the same thing. So you're going to push up with the affected side, push down with the unaffected side. So push down and hold for 5, 4, 3, 2, 1, and then ease off. And then you can do that again. And you're going to aim for 10 repetitions. And like we said before, you can progress that with time. Now, this principle of keeping the elbow bent and straight is a really nice way to settle your symptoms down as part of your treatment. There's more load going through this tendon when your elbow is straight compared to when it is bent. So you will find that your pain is much more comfortable if you lift things and keep them nice and close to you with a bent elbow. For this next exercise, you will need a little bit of weight, and it can be something as light as a can of beans to get you started. And what you're going to do is an eccentric exercise, and that basically means you're going to contract the muscle whilst it is elongating. So when the muscle is lengthening, that's the part that we're going to load. So how you're going to do that is you're going to use your good hand to hold on to the weight, use the affected side to get you into that flexed position, and then you're going to hold on to it and gently lower down. And you want to make sure that you're doing that in a very slow and steady way, because in order for this tissue to adapt and change, that tendon needs time under load. So I would be aiming for around 3 lots of between 8 and 12 of these. Now we've started to move through range. Exercise 4 is going to be very similar. You're going to keep your elbow in that 90-degree position. So again, we're keeping an eye on this to make sure we're continuing to monitor the amount of load going through this area, but you're going to do the whole movement this time. So you are not going to need assistance from the other side. You're just going to go all the way up and then all the way down. Again, nice and slowly, nice and controlled, so that tissue has time under load. And then very simply, exercise number 5 is going to be a progression of this. You're going to do what we did earlier and go from having your arm at 90 degrees to having your arm in a straight position. So straight away, even with the same amount of load, there's more load going through this medial epicondyle because your elbow is straight, and you're going to do exactly the same exercise. Nice and slow, nice and controlled. So there's a few different options within today's video that you can try, and the reason I've done that is because golfer's elbow is a massive spectrum of severity. So I see people at the quite good end of the spectrum that can spend a whole day doing manual work for 8 hours and just have a little bit of soreness in this area. But at the other end of the spectrum, I also see people that struggle to lift a cup of tea because their symptoms are so sore. Obviously, for that person, the exercise that they are trying to do is going to look very different to the exercise that somebody with far less irritable symptoms is going to be doing. It might be that these guys are not doing any exercise at all, and there's things that we need to try and work on to calm things down. So please bear in mind when you're looking at videos online and on social media that they are general, they're generic, and they're not bespoke and personalized to you. So if you are struggling with golfer's elbow and you would like something that is more bespoke and more personal with regards to your symptoms, then I do see a very small number of private patients every week, both online and in person. If you are local enough, you can find information about how to book that in the description below the video. But if you found it helpful, please do like and subscribe. It means more people will see this video. And whilst you're doing that, I'll see you in the next one.